Hey everyone, it's Dr. John Burroughs at Springs Aesthetics, and I wanted to take a few minutes to talk about ears. One of the procedures we do here is for patients that have lower ear issues. These include having had gauges in their ears to where there's large holes and the lobes are enlarged. Many of our patients have been trying to get into the military and they can't get in with, earlobes that are hanging down to their shoulders, or if they have large holes there. So that's something we can do right here in the office, and I'll tell you about that in just a moment. We also have patients that have kind of the pixie ear where it's fused down to their jawline right there. We can address that to give them a lobe again. And then another popular procedure we have is especially in grandmothers, is when they get a torn earlobe. And that's from, a grandchild or even mothers, a child reaching up and grabbing and splitting the earlobe all the way through. And then others, just from age, they get earlobes that, start to hang down. They're concerned about wearing earrings because that pulls them even further. And we can reduce the size of that to give it a more youthful appearance. Many of you know that as we age, our ears are one of those structures that we have that just keep growing, unfortunately. So if you haven't noticed that before, look at your parents and pictures from long ago, and then when they're older, and you'll see their ears have gotten taller and stretched out. So we do these procedures here in the office. You don't even have to have sedation most of the time, just a little local anesthetic. We're not going to give you an unusual appearance like an elf ear or some kind of appearance you don't want, because we're doing this for your appearance or functionally so that you can wear earrings again, which is very, very important to many, many people. So basically, once the area is anesthetized, we can reduce the size of the lobe quite naturally. We can repair when it's elongated or has a large gauge defect, or even if it's just an earring defect that's gotten too enlarged. We also can remove when you have multiple piercings that you don't want, and we can also address the pixie ear, and you just all done with small incisions. You do need some sutures to keep the tissues back where they need to be until the areas are healed. And once things are healed up, you can then get them re-pierced about 4 weeks later. So I just wanted to cover that. People have concerns about their ears, especially our lady patients, but there's a lot of male patients coming in because they feel like their old gauges that they regret having had done in their teen years or their early 20s, and now they're trying to get better paying jobs or to enter the military, that they need to have those addressed, and they can be addressed in usually about a 1-hour surgery here in the office. So if you have questions about that, give us a call at Springs Aesthetics, and I'm Dr. John Burroughs.